Hello, everyone. This is Chris Frederick with the Stretch Institute, and I'm really excited to be here with one of my teachers, actually, Jenna Schroer. Welcome, Jenna.
Thank you, Chris. It's good to be here.
Yeah, it is. I understand, you've having a lot of success with FST. Um, Especially recently, I've heard some stories. So I'd like you to share some stories because I think it would be inspiring for our students, firstly, our graduates, as well as those who are thinking about maybe getting trained in FST. So maybe let's start a little bit with your journey about as an occupational therapist and an FST practitioner now, specialist. Maybe share with us a little bit of your journey, how long you've been in OT, if you have a specialty in that, what kind of patients you work with, and then how you found us. How did you find FST and your journey from FST?
Sounds great. Thank you. So yes, like you said, I'm a teacher at the Stretch Institute, which is phenomenal. And I'm also the owner of my own practice called Stretch Spot. And I work out of the Institute as well. I have a history of occupational therapy. I've been a licensed OT for about 14 years now. And I started my journey with the adult sector, working mostly in rehabilitation. And I moved into outpatient neurological for about 8 years. So that's where I spent the majority of my time, was in that outpatient setting, working with people who had stroke, Parkinson's, multiple sclerosis, brain injuries, just a variety of things in that nature, mostly in the adult rehabilitation world. I then moved into working with pediatrics in special education for about 6 years, working with kids with developmental disabilities. And there's actually a lot of overlap between developmental disabilities and the neurological population that I found, which was quite interesting.
Mm.
At that time, I was knowing that I was burning out a little bit. I was getting a little tired of the healthcare structure, working for administration that pushed a lot of productivity standards that weren't realistic, as
Right.
well as the demands of various insurances became quite challenging because I wasn't seeing the progress with my patients and I wasn't seeing what they required. Oftentimes, I knew what my patient required versus what a doctor or insurance would try to tell me when they didn't even know the patient. So it
Yeah.
was getting more frustrating seeing the shift of the healthcare industry and where it was headed. And frankly, I didn't want to be part of it anymore. And it had nothing to do with the patients and helping people, but rather the direction of all of the insurance, legalities, productivity standards. And I
Hmm.
think there's a lot of burnout going on in the healthcare world right now because
Yeah.
of those regulations that everyone's trying to follow. So I was looking for something else, and I knew it wanted to be in health and wellness, but I wanted more of a preventative service for people. I was on the other end of the spectrum where I was rehabilitating people. And I
Hmm.
really wanted to be on the front end of it where I could help people before issues became chronic, with the chronic pain, and just try to get ahead of those things.
Great. Well, thanks for sharing that. I can relate as a PT. I did the same thing, and the just in a nutshell, the medical system is broken. There's a lot. It's all crisis driven and not prevention driven. So I totally understand that, and I exactly did the same thing in my practice. I went into FST, and I was able to prevent issues before they became a crisis. So that sounds great. So your most recent success sounds really cool. You got into professional athletes you're working on now. Is that kind of a new thing that like have you ever done that in your as an OT, with professional athletes?
No, I haven't. I haven't
Right.
worked with professional athletes.
Right.
It's always been an interest of mine to work with athletes in general. I played a lot of sports growing up. I love sports. My son is in a lot of sports. And so that's always been an interest of mine. And I've never been able to have that opportunity until now, which has been really fun. I've started with some high school athletes working FST as well as an older population, such as some of my golfers, people that play pickleball, and now moving into the professional athletes. And it has been absolutely phenomenal working with them.
Yeah, so we're obviously not going to name names of individuals or teams. Um, but we can talk about positions they play and how big they are. So you've worked on someone who's quite enormous, and then you worked on someone who's not as big, and it's a totally different position based on more speed and all that. So without me, spoiling it, can you just talk about the contrast, and then I guess with one of them you're spending more time with. Just talk about the contrast of who you work with and how that was, and then we could shift to the one you've seen on an ongoing basis, and sort of, we can talk about challenges that the athlete had and then how you help them.
Absolutely. So yes, one of the athletes that I worked with was a lot larger than myself. And for people who haven't met me in person, I'm quite small. I'm about hand size. I'm 5'2", and not very thick. The athlete that was a little bit on the larger side was a lineman, about 6'6", 325. And the first question that people have is, well, how could you move somebody that much larger than you? And I have Anne as my mentor, and the fact that we're about the same size, it has been incredible seeing how she's able to move some of these bigger athletes. And I just try to kind of replicate what we've learned with our basic FSC principles, is protecting myself while I'm protecting my client, and really learning how to use my body, which is incredible because as an occupational therapist, we work a lot with ergonomics and body protection and joint protection. So it flows very nicely into this. And
Mhm.
so it's been a learning experience, but it was a lot easier than you think it would be when you learn how to just use your body and not work very hard. Even if it's someone who's that large and that much larger than me, it's quite doable. And it was tremendous to see how his body is able to move when I use those principles.
That's very well described, and I think it's going to be helpful for people to hear words of wisdom like that coming from Anne Frederick, of course, who invented and created the technique on big people, specifically NFL players, and how handing the legacy down to you and others is still having that success and spreading it forward. So that's really cool. So let's shift to the other player. What position?
He is a cornerback,
Okay, so
and he's
they're
a little bit,
fast. They
yes,
backpedal. They're fast players.
yes, a lot of dynamic movements, diagonal movement patterns. He's about 5'10", 195, so a stark difference from my other player. But he's been a joy to work with as well. He actually came to me with an injury that has been a focus for over a year now, almost a year and a half. And it was a groin injury. And so I just started implementing my normal FST principles and movements and stretches that we use. And even after the first session, he noticed quite the difference in improvement when he got off the table.
Mm.
He came in limping and he walked out the door feeling great. Now, knowing that oftentimes the effects can diminish, and because he is a professional athlete that has a lot of demands on his body every single day, we did work through a few sessions. But even after 3 or 4 sessions, he was saying that it's the best he's felt yet this season. It's the best he's felt in over a year when he's done physical therapy, exercises that the trainers have him do. This is by far the best that he's felt, and to the point where he wasn't sure if he would even finish the season. And
Mhm.
now he's confident that he'll finish the season, and he thinks he'll finish the season without any pain or anything holding him back at this point.
Wow, that's amazing.
It is
So,
amazing.
there's a lot of background you have that also prepared you for this. Could you tell our listeners what training, more advanced training in FST you've done that specifically addresses professional athlete issues?
Yes. So I have completed all of the levels, 1 through 4, which was formerly known as our sports in our review course. With that, a lot of the information or moves that I use with him, you could say, are from 3 and 4. I definitely use some of the protocols from 1 and 2, when I'm moving his body, a lot has come from the 3 and 4, which is really fun because when you're working with the athletes, you are thinking about what their bodies need, how their bodies move on the field or on the court. And I'm taking a lot of the things that I've learned from level 3 and level 4 and putting it into our sessions together. And with that, it's a lot of fun when you can watch the games or watch film from these athletes to see how does he move? What does
Yeah.
he specifically need with pushing off that left foot and how his body's moving on the field? Because then you can bring it into that customization piece. And that's what makes FST so different from other things out there is it's customized for each person and what their body truly needs.
Outstanding. Well, with that, thank you very much for sharing these stories. I know you have more, but I think we'll cap it there. And I think so people can find you if they want to have a session in Chandler, Arizona, is where you're located.
Yes.
Could you just give information about the name of your practice, repeat your name again, and how do they get in touch with you?
Absolutely. So again, I'm Jenna Schroer, and the name of my practice is Stretch Spot. You can find my website, stretchspotaz.com. I'm also on Instagram, stretchspotaz, or you can even email me at stretchspotaz@gmail.com. All the Stretch Spot
Awesome.
AZs.
Yeah. Okay, Jenna, we'll end it there. Thank you so much for your time and stay on. We'll talk a little bit after this interview ends, which ends just about now. So have a great day. Thank you so much.
Thank you, Chris.